It's okay to fail. It's fine. Who cares? Don't worry about what people think.
Super excited about our guest today, Dr. Bryan Frantz.
I believe part of being successful, Peter, and I've said this to you, whether I'm involved in teaching, a business meeting, I want to look good. I want to be my best because you know what? You will stand out. Don't worry about what someone else is doing. Because every time you're worrying about that, you're taking away from 1 second of what you can be doing. And you know, one of the things, Peter, honestly, that I've preached to my kids since they're little is there is no such thing as failure, right? There's no such thing. If you make a mistake, so what? Get up, we learn from those things, right? And you know that. And so, it's okay. Don't be afraid to fail.
Welcome to Thread Talks, where we stitch together tales of style and substance. Join us as we chat with industry icons, master tailors, innovators, and business experts. We'll discuss how to look and feel your best. Explore how fashion shapes our lives, the artistry behind custom clothing, and the deep stories woven into the fabric of our identities. Here's your host, Peter Roberti of Adrian Jules.
Okay, welcome back to Thread Talks. Super excited about our guest today, Dr. Bryan Frantz out of Scranton, Pennsylvania. We are such a great opportunity to have him here. Thank you so much for being on the show today.
Peter, it's my pleasure, and I'm really looking forward to this. I know we're going to have some fun today, so it's my pleasure. I'm glad you asked me to do this, and I'm looking forward to it.
Yeah, I feel like every single time I'm at your office, we almost do a mini podcast. So I said we've got to do this.
It's the truth. We do.
So hey, why don't we? Before we kind of jump in, I know I've got a bunch of different ideas questions I wanted to run by you. Why don't you just tell everybody a little bit about yourself, your story, because you're just, especially in your industry, you're an icon in your industry. I know you. Yeah.
Thanks.
So why don't
thanks a lot for that. No, yeah, sure. So basically, Peter, I'm from Scranton, Pennsylvania, as you alluded to. The fast version of this, if you will, is I did my training at the University of Rochester undergrad, which was sort of my first introduction to Rochester, and then did my dental school training in Philadelphia at Temple University, and then wound up back in Rochester at the Eastman Dental Center to do my specialty training in periodontics and dental implant surgery. My wife, Linda, as you know, is an internal medicine doctor, and she did her training at Eastman, at Strong Memorial as well. So, and she's from Scranton as well. We have 3 children. 2 of the 3 are in practice with me. We have a multi-specialty practice here in Scranton, which is a very unique model. We're all under one roof and practicing together. Our youngest daughter is in optometry. And, the joke is she said no more. By the time we got to her, she'd had enough dental talk. So she does her own thing, but we are trying to figure a way to get her under the roof with us. We're talking about that. So she can't totally escape. But yeah, I've been in practice for, I guess it's like 36 years now. I love what I do. I love getting up every day, coming into work, and, built a facility here in Scranton in 2000. We built our own location, and we can get into that later if you want in terms of why I did that. Yeah. But I'm involved in organized dentistry. As you know, I've been president of the American Academy of Periodontology, our foundation, and now I'm involved with the board certification arm of our specialty. So I love that aspect of it. Yeah. And I'm still teaching at Eastman Dental Center. So still very involved in that aspect of it. Wow. So yeah, and then there's some things in the community we get involved with as well. But that kind of in a nutshell, that's kind of who we are and what we're doing.
Yeah, that's amazing. I think that it's interesting to hear how much stuff you've done, how much stuff you're doing, and still actively doing and continuing to grow. What's your big why? Like why you keep wanting to do more? Like what keeps you going?
Well, it's a very interesting question. I mean, on the surface, you could say, well, my daughter, Kristen, and she's a periodontist as well. and
Sure.
her and I practice together, and she's
Sure.
brought in a tremendous amount of energy to the practice and, a younger person's perspective, if you will. But to be honest, and she would tell you this, with or without that, I'm just wired that way. I really, again, I love what I do. I love taking care of patients. I love the field of periodontics because it's sort of like medicine, if you will, where we're taking into account the entire patient. It's not just their teeth or their gums. I mean, a lot of what I deal with has to do with systemic issues like cardiovascular disease, diabetes, things of that nature. So I really love that. But what I also love is how our specialty has evolved over the years. And so to that point, I've had, and I say it's funny because I say this a lot recently. There's been 4 paradigm changes in my practice career.
Okay.
The first one was had to do with bone regeneration around teeth. That was a big deal when I came out of my residency, and it still is. Periodontists, what we do as specialists is we can grow bone around teeth. We can grow bone to put implants in. That's what our specialty really, one of the main things that we do. So that was really cool. Then it evolved into actually implants. So I trained at a time when implants weren't even part of our residency. So I had to go back. I recognized the value of dental implants for patients and restoring their health and their oral cavity back to normal function. So I went back, got trained. So that would be the second paradigm change. The third has to do with digital dentistry, and that's sort of what I showed you when you guys were in, a few weeks ago. I showed you how we've evolved into that, and so now, through that's been probably 20 years of evolution. So we do everything from design work to production of the final teeth here in our office, and then the fourth one, which has just occurred recently, and it's really been a powerful one, I have to tell you. Out of the 4, this one's my favorite, and that has to do with longevity and really looking at a patient through a different lens in a way that I haven't looked at them in years. Okay, so a conversation that I had with a patient, one of the questions that I'll ask a patient is, this particular one was 60. I said, tell me, how long do you want to live? What do you think your life expectancy is going to be? 90, she said. I said, and tell me what you think when you're 90, what do you want to do? Well, I want to do everything I do now. I want to be able to golf. I want to hike. I want to travel. I said, great. What do you think your teeth should look like? Well, I want them to look like they do now. I want to have all my teeth. I said, perfect. So now we start to look and we say, how do we take a patient today? And I would use you as an example, Peter. You're young. You're fit. You're in shape. You work out, and I would say to you, where do you want to be when you're 80? Where do you want to be when you're 90? Because the probability is you're going to live that long. Yeah. So we not only look, I call it oral health span. I don't call somebody, what's a patient's dentition going to look like in 20 years from now? And how does what we're doing today and considering today, how does that impact their well-being later on in life? And it's really, and I have to tell you, it's a fascinating, you look at patients that have different systemic problems, we're working with them in conjunction with their physician and their other healthcare providers to say, hey, I'm going to do this for their teeth, but let's take a look at this patient as a whole and say, do we need more exercise? Do we need to consider weightlifting? Do we need to consider nutritional counseling? All of these things, to help the patient, as they age. So to me, it's been cool because I'm getting to interact with patients in a way that is different than I normally have in the past. And my staff will tell you I'm one that you can tell now I like to talk and I like to interact with my patients, but it's really cool. It's really exciting. And we're, so that's kind of the fourth paradigm. So that's, there's a lot in terms of the why, right?
Yeah. I like that because it's almost like you're talking about what their life might look like 20 years ago and essentially taking this holistic approach and operating for that, and making sure that, everything that they have going on for their teeth is going to be okay down the road.
Absolutely.
And doing
a lot of prevention. And it's a fabulous, like I said, it's a very interesting set of questions that, I'll ask patients and to get their responses. But I can see it, they start to understand, hey, we're talking about prevention as a whole here. Like, for example, I use the term oral health span. There's a difference between having, your teeth and being able, but to chew with them and to look good and to function comfortably. That's a whole other idea, right?
Sure.
We all know we can be 80 and have, some teeth, but if they're not looking, you're not going to feel the same. You're not going to have the same self-esteem. You're not going to feel and that impacts your overall well-being, your overall health. So yeah, it's pretty, and I have to tell you, if I can take 1 second.
Sure.
Peter Attia I'm going to give him, I don't know him, but he wrote a book called Outlive. And it really is a fascinating book that talks a lot about sort of what I'm referring to in medicine.
Mm-hmm.
And so when I've read the book actually 3 or 4 times now. There's a lot of information. It's a well-written, very concise book. And, but he's got a podcast that's really cool. And I kind of follow that because he gets off into all kinds of things, sometimes a little too much detail. But that thought process of prevention and looking at the future for patients and kind of incorporating things, that's sort of what got me thinking this way. So I don't want to take full credit for that, but that's a topic. Longevity is something that I really look at and have thought about. His book sort of put it together for me in a way that I could put it in my practice.
Yeah. So I want to back up 2 steps. So talk to me about your practice here. So
sure.
I'm in a family business too.
Mm-hmm.
Obviously, you got the girls involved in it. Your wife's involved in it. Walk me through some of. Some people say, "Oh, it's tough to work with family." I love working with I love working with my dad. I mean,
yeah.
I've got other family members in it. I love doing it. I mean, I think that it's an opportunity that not many people have. I mean,
yep.
what's your take on it?
Yeah, I mean, what would be an interesting podcast is me and your father to do one to say what it's like to bring you guys in. Because really, trust me, that's the secret. No, it's fabulous. I mean, in our facility, it is a family facility. I mean, my wife's on one side of the building. She's an internal medicine doctor, a very key part of our team. We consult with her and use her all the time on our cases.
Sure.
Kristen does what I do. Plus, she gets involved with the teeth reconstruction, and our other daughter Andrea is an orthodontist. Now, to add a layer of potential difficulty, their husbands one's an oral surgeon, one's an orthodontist. So there's, this whole thing is like trying to balance all of this, right?
Right.
But they're great. The kids, I like to say they humor me, Chris, they listen to me. I know when they're taking my advice and I know when they're not. And when they're not, I just let it go. I don't try to push it. And I think, so it's a give and take between, the both sides. Like I'm in this 36 years and there's certain things that I can help her with.
Sure.
She helps me with certain things. So I'm very open-minded. I want to hear what she has to say. She wants to, so it's really been, and my son-in-law is the same thing. I mean, they're great. They're really part of our team.
Yeah.
They don't practice in the same facility, but it's been great. I love it. It's I think I would have to say I'm very blessed that, but I do feel strongly that because I've seen some of my friends that have gone into family businesses and the dad, is really tough. You're going to do it my way. In fact, I could tell you a funny story about a guy who's very successful in the meat packing business. And I said to him, how did you went in with your dad? What was that like? Similar to what you're asking me. And he said, well, it was really straightforward. He said, one day I went into my father. I was there like maybe a week or two. And I said, Dad, I think we should be doing it this way. And my father, he said, his father said to him, that's great. If you don't like the way we do it, you can leave. I don't do that. I'm open. I want to hear ideas,
Sure.
So, and I'm sure your dad's the same.
Yeah. I mean, he he wants me to make my own failures too. Like he wants
100%. Yes.
Like I've tried it, but you could give it a run at it and see if maybe this might be different. Your way, you might get a different result. I don't know.
And you see, that's what I'm talking about. Your father's open-minded enough. And so I think if in a family business, if the older generation is a little bit open-minded,
sure,
give the younger generation their room to grow. Hey, we're going to give you advice. And, I just think with that attitude, it becomes fun. And, one of the things, Peter, honestly, that I've preached to my kids since they're little is there is no such thing as failure, right? There's no such thing. If you make a mistake, so what? Get up. We learn from those things, right? And you know that. And so, it's okay. Don't be afraid to fail. It's fine. So I don't look at it that way.
Yeah, that makes me think about how important that having the right mindset is when you're running a business. I mean,
it's everything. Yeah.
Right? I mean,
everything.
I think that it could, especially like I think it sometimes could be the make or break with a business is your mindset and where you think it might go.
Man, I'll tell you, you hit on a subject that I absolutely love reading about, and I couldn't agree more. It is a mindset, and it's not only a mindset for you or for me, but really it's a mindset for our team. And so my staff, my team, they understand what our mindset is, what our culture is, what we're trying to do here. And so that really helps drive, what we do. It is a mindset, but we can't be successful. I can't be successful without my team. They have to know my mindset, and I couldn't agree more with you. And it's something that I do spend a lot of time reading and studying and, seeing how can I be better with that mindset? How can I be a better team leader? How can I, and, you and I have talked, this is how you and I, that's how we go off on these mini podcasts all the time, and this is what happens, right?
I'm curious how often, I'm just curious what your thoughts are on this, because as Adrian Jules continues to grow, like how often do you talk to your team about the vision and the mindset of where we're going? Like how often do you talk to them about that?
Fabulous question. I will tell you that it occurs at least once a week. Sometimes at least, sometimes more, Peter. Sometimes I will come in and I'll feel that the team, maybe they get it. But they're not that they're slipping, but maybe some questions that they're asking me during the day kind of leads me to believe that they don't really, that maybe they need it just kind of reinforced a little bit.
Yeah, they need to recalibrate. We need a
little recalibration. They're totally motivated, totally committed, but sometimes, and I might, by the way, have a different thought. I may want to say to them, hey, I want to talk about something from yesterday that really highlights and gets to the core of what our culture is. What is our culture here? What's our, what is it that we're doing? It's actually culture, purpose. Okay. Once I get those two things, really we talk about that. Those two things really drive behaviors. So if my team knows what the culture is and they know what our purpose is, they're going to know what the behavior is, right? They're going to understand that when we have it happens every day. Patient calls, they're in pain. They don't come and get me. They put the patient in. They find a way to help the patient.
I love it.
That's our culture. That's our purpose. That's why we do what we do. And honestly, the culture is really, we're trying to provide the highest level of care for patients. And it's not easy. You have to, the technology that that we've grown there, the creating the culture, having the right team, having the right facility, having the right training. We're all under one roof. We really have built something unique here. And I know that, just like you have. And I watch what you do. And my staff said to me, because they know you, they're like, well, you're doing this podcast with Peter. Like, why? And I said, because every time he comes here, we talk about 50 different things, most of which isn't even closed, by the way. We get off on these tangents, right? But anyway, so all of those things, Peter, I think are important in terms of mindset.
Yeah, I love it. I love going deep on mindset because I just think it's so important.
You gotta. I'll throw a book out at you that I just started.
Yeah.
It's called Traction.
Traction. Oh,
Traction.
Yeah. Traction. Yes. I know the book. Yeah.
There's another one too, Energy Bus by John Gordon. Jon Gordon. Excellent.
Let me ask you something. I feel like there's, at least through my journey with Adrian Jules, there's specific like years that have like that stuck out with me. Like either they've been just tough years and we're just grinding through it, and on the other side of it, it's just been we've exponentially just continue to grow, or different years where we've opened showrooms and so on and so forth. Is there any standout years that
Absolutely.
you feel?
Yeah, absolutely. That's a super question, and what comes to my mind would be about 1999. I had been in practice. Yeah.
Okay.
Were you even, I don't know if you were born yet, but were you alive then? But in 1999, I'd been in practice for about 11 years.
Okay.
And I was renting a facility in downtown Scranton. And, Peter, all of the things that we were talking about, all of that started honestly from the day I started my practice. I always wanted to have my own practice and do things the way that I wanted to, a certain way that I felt would be the best way to take care of patients. I'm not saying it's the only way, but it's a way that I wanted to do it. Anyway, I was coming to work one morning and I was just not happy in the facility that I was in because I couldn't really control my environment,
Okay.
And if I had to pick one single thing that I did, would be to say, okay, I'm going to not rent this facility anymore, and I'm going to build my own facility. And I'm going to build my own facility so that I can position myself for the rest of my career in terms of the technology. Well, so that our building, you can see, we have a teaching facility, I have a laboratory, we have clinic space. Okay, my wife and I are here, it's a family. So we control the environment, right? I can put every year, my staff will tell you the carpet's out, we're painting, we're whatever it takes to have it state of the art and clean and neat and nice all the time. That's what we do. I can't do that if I'm renting. So I would say, to your question, that's probably one of the moments in my career.
I love that. It's interesting because we work with not a ton of people, but guys that have their own have practices. How is it? I feel like there's a difference, like you said, like you're renting it or you're working at, might be a hospital or something, or within a umbrella of a company. I feel like you've built your own practice and your own business. Like, how does taking that business mindset and incorporating it into your practice helped you with building what you have there now?
Right. I'd attempt to answer it this way. So something that I've always felt is important, whether you're a periodontist like myself or a business person, whatever it is, I really feel you have to have a vision of where you're going. Okay. Where do I want to be? And really spend time. What does it look like? So I would always look at this in 5-year increments and say, where do I want to be in 5 years? What does it look like? What do I have to do to get there? What's the expenditures that I have to look at to build this so that in 5 years I have the technology, I have additional training, I have the team, all of that. And then I look at a 10-year. What does it look like in 10 years? And I use metrics. I look at a lot of data to help me make those decisions.
Yeah.
But I think that's something that's critical in any business. Is if you're going to grow and you're going to, remain relevant with your client base, patient base, I think you have to think that way.
Yeah.
And I think you've got a vision, strategically plan. But here's the killer: is the implementation of your strategic plan is the hardest part. That's the hardest part. It's really, really tough. The last one that I just did with our laboratory and the investment and to implement that, get my staff trained, get the software, the hardware, all of that rolling. I could do a podcast just on how that evolved. I mean, it opened up so much that now I need a second person down there just for my own practice. Not that it created business, I guess, if you want to call it that. And by the way, I do want to say this. I've never made a decision based on money. Never. It's always been, what do I think is the best possible model for my practice business, because they're both, and how am I going to get there, and what am I going to do? I never looked at it like, oh, I have to spend this, or what's my ROI? Okay. I mean, it's, you do look at that kind of later, but if you really believe in it, okay, everything comes. It just comes, So I always try to, like, when I'm talking to people, I'm like, don't worry about that. Do you believe in this? Is your heart in it?
How deep do you believe in it? Yeah.
Hey, and I've made mistakes too. I've bought stuff that, like, oh, okay, I don't care. I thought it was the right thing. It wasn't. I've made bad hires. I've done it, and it's okay. It's okay. Yeah. Like I said earlier, we don't fail. We learn and move on.
Yes. Yeah. We've done a lot of learning. Yeah. Right. Let me ask you two more questions.
Sure.
What would you, I'm curious, in 15 years from now or 20 years from now, you've got a new hire that comes in, and they put in a tape that's you telling them about your practice and what the DNA is all about.
Right.
What would you tell them? How would you describe? What would you tell them? What the message and what your core is all about? I'm curious.
Sure. Well, it would definitely start with what our culture is, and that would be, providing the highest level of care for our patients at all times. It starts with that. Then into our purpose. Why are we here? What are we doing? Into our niche. What are we? Our niche is that we're, and I would go through those things. Okay.
Yeah.
And that's what that message would contain: culture, purpose, niche, pretty much.
Love it.
In that.
Love it.
Yeah.
Love it.
Yeah. And I would definitely want my senior leadership team to be part of that video.
Absolutely. Yeah. I know you listed a bunch of, you gave a couple different books. Is there is there a specific book that stands out that is a must read, or is there a quote that you kind of live by that I should know about?
There is, there is. I do a lot of reading, and it's actually to a point where sometimes I think I have a problem. Like right now I have 11 books on my nightstand, some are history, some are, leadership, some are that. It's crazy, but there is one, okay. And actually, I hang this. It's in my office, and it's in the one area for my staff. We all look at it, and it's actually it's not really a book. It's a speech. It's an excerpt of a speech that Teddy Roosevelt gave in the early 1900s, and it's called "The Strenuous Life." Have you heard of it?
Strenuous Life. Okay. Yeah. Okay.
Okay. And in that, there's an excerpt in that speech, and he's referring to the man in the arena. Okay. That's really what this speech is known for, the man in the arena. And what the man in the arena really speaks to is, the critic really doesn't count. Okay. It's the guy that's in the arena who's working hard. Okay, who's striving, who's failing, who's winning, okay, all of those things, okay, that's what counts. Not the guy that's sitting up in the stands looking and saying, look, he failed, okay, look, he did that. It's not the critic. And so I look at that, and my staff, we have it in a prominent area there, and it's like, hey, it's okay to fail. It's fine. Who cares? Don't worry about what people think. We're committed to this mission. Don't worry about what anybody else is doing.
Yeah.
My staff they hear me, and my kids too, from their kid, don't worry about what someone else is doing.
Yeah.
Because every time you're worrying about that, you're taking away from 1 second of what you can be doing. So I would say The Man in the Arena, Strenuous Life, Teddy Roosevelt, that's the one. I go to that all the time. Yeah.
Love it. Well, again, thank you so much for the
My
opportunity.
pleasure.
This was awesome. I was looking forward to chatting with
Me
you.
too.
So this was great. This is awesome.
Me
Thank
too.
you so much, Bryan, for doing this.
Absolutely, my pleasure. And can I throw one other thing in?
Yeah.
Really, and this is to you. Really, I love what you guys are doing. I love your energy. I love your model. I love I love the product. Okay, and I know I know you didn't ask me, but I'm doing it. I believe part of being successful, Peter.
Yeah.
And I've said this to you. Whether I'm involved in teaching, a business meeting, I want to look good.
Yeah.
I want to be my best, because you know what? You will stand out. Okay. You will stand out, and you don't want to be oh, maybe I'll just put a pair of jeans on. I mean, everybody does that, right?
Yeah.
So you want to separate yourself. And again, it goes back to your overall, you want to look good, feel good, all those things. You got to dress right. You really do. It's in this day and age. I mean, I think there's more coming back where people are dressing up more.
Yeah.
I love to see the 3-piece suits now. They're coming back. I kind of like those. But anyway, I just feel that, our friendship kind of developed through the clothes, and then it evolved. Okay. But I do feel what you're doing is a very important aspect of someone being successful in what they do. So I wanted to mention.
I mean, just the impact, both what you do, what I do. I mean, that's part of this. That's the why. Like having, being an impact and making an impact on these people's lives. I mean, the stories you've told me and how you've changed people's lives. I mean, that's
overall.
It.
Yeah. That's it.
Yeah,
That's it. So I appreciate you having me. If you're ever stuck, we can talk about something else some other day. We can talk about a lot of things. So anytime.
I was going to say.
Yeah, it was fun.
All right, good. All right, Bryan, thank you. Cheers.
See you, Peter.
That wraps up another episode of Thread Talks. To dive deeper into the stories and expertise shared today, make sure to check out the show notes for more about our distinguished guests and the exceptional craftsmanship at Adrian Jules Custom Clothier. Loved what you heard? Don't forget to hit 5 stars, leave us a review, and remember, dress to impress today. When you look great, you feel great.